Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and today, Friday, on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 3rd of June. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Zoe Bukowski, who's a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great, thank you, Sophie.
In the United States yesterday, we saw 111,000 positive new cases, and we are now peaking at a 7-day average of just over 100,000 positive cases per day. While we are seeing a 3% decrease over the last 14 days, cases are still surging. Hospitalizations have increased by 17% over the last 14 days, and deaths are fortunately decreasing by 7%. In Illinois, yesterday, we saw 6,000 positive new cases, with the cases decreasing by 26%, but the hospitalizations increasing by 19%. What can you tell us about what is going on with these statistics, Dr. Murphy?
Well, we're a couple things. One, we're still going up in this wave. So this is the 6th wave, and it's increasing. The numbers are worse than what you're saying because the home testing is not included. We're going to talk about that a little later in one of the stories. Because the estimates are all over the place. The other thing is, remember that from the beginning, this thing has always come in waves. So we're going to hit a peak and then it's going to go down. So hopefully that's going to be soon. We must be getting close to the peak now because so many people have been infected. So then we'll see a decrease, because the population has immunity and they're taking their vaccines and whatever. And then it'll go down again. And then when will the next wave come? It's anybody's guess.
Yeah, this goes right into our first headline, Dr. Murphy, which is COVID isn't the only viral disease surging in the Americas. A top WHO official is now warning. What can you tell us about what's going on with monkeypox, the hepatitis B, the flu, etc.?
Yeah, well, when people were mitigating against COVID a lot, they were staying indoors, wearing masks, staying away from people, closing certain venues, etc. A lot of other infectious diseases went down, but everything's opened up again. And, this monkeypox thing is just really coming out of the blue. Monkeypox is transmitted person to person. It doesn't have to be sexual. It's not considered a sexually transmitted disease, and neither is the flu. But, whenever you're in close contact, groups like that can get infected with either of those infections. And so we'll see more of those. But, the flu is likely not to change too dramatically. About 100 people a day on average die from the flu per year. COVID is about 300 plus per day. So, we'll see what happens with that. Fortunately, we're not seeing a big increase in hospitalization, ICU rate, or deaths from COVID. That doesn't mean they're not happening, and they're still more than the flu. But, that part is still holding up. And those numbers are pretty firm because when a person goes in the hospital, the first thing that happens, they get tested for COVID, and that gets reported. So these other infections, the other one that's floating around, that's a real mystery right now, is this hepatitis in kids, mostly under 6. They have the age range goes up to 10 or 12, but most of them are really young, and they don't know what's causing it. About 10% of those kids are requiring a liver transplant, which is really, really, really severe. It's really just uncertain what is doing that. Right now, there's about 650 kids have been diagnosed in 33 different countries. There's about another 100 cases pending confirmation. The closest infection that's been associated with it is an adenovirus, which can cause the flu, but it can also cause gastroenteritis, can also cause hepatitis, adenovirus 41. And but some of the kids that have got this thing don't have that. So it's really quite mysterious. There's also potentially a link to COVID itself. A lot of these kids had COVID right after they were diagnosed or just before they were diagnosed. But again, it's no one knows if it's a cause or effect or just an association or is completely unrelated. Illinois has 9 cases of this right now. And so it really remains to be seen what causes this and what we can do about it. There is no real treatment for adenovirus. I presume we could make a vaccine for it or something if this is going to continue. But right now, if anyone, any child gets anything even closely related to hepatitis, they get jaundice, their stools turn a light color, urine gets dark, they're feeling sick with stomach pain, whatever, they need to be evaluated very quickly. Because if they go to liver failure, they're going to need a transplant, and that requires some very intensive therapy.
Yeah, that's incredibly sad.
Yeah.
And we're going to our second headline, Dr. Murphy. One, a little bit confusing and positive all at the same time, is that South Africa was hit by a wave of COVID infections, but 98% of the population had antibodies. What can you tell us about what does this mean for what could happen in the United States?
I mean, so it's about 2/3 of the people in the United States have some kind of antibody, whether it's from the vaccines or whether it's from prior infection, might even be more than that. The Africans pretty much look like they've all been infected with Omicron because their vaccine uptake rate is quite low. Now remember, they're a much younger population. The mortality rate projections were way off from the beginning with Africa. It is not just underreporting. So I just saw a projection, actually I was reading about it today, that for 2022, there may just be 20 to 30,000 deaths from COVID in the whole continent. I mean, there's 1 billion people in Africa. So that is really just remarkable. And this data from South Africa, I think is telling us something, in that these people have a lot of immunity to this virus.
Yeah, absolutely. And now going into our third big headline, new variants are poised to keep COVID circulating at high levels throughout the summer. I know if you remember last summer, Dr. Murphy, the whole thing was that the summer cures the pandemic. What can you tell us what this actually means?
Yeah, so there's so much floating around. The summertime is usually when this goes down. Now, we haven't hit the peak, but that peak, as we get into summer, it's very likely that it's going to drop off pretty significantly. But we haven't hit the peak yet. But so many people have gotten infected. And they're going to be at least be immune from the current variants that are floating around. So the new ones that are popping up are BA4 and 5, which were first identified in South Africa. And that's accounting for about 7% of the new cases in the United States. And it's been detected in over 30 countries. And so right now, still the most common one is BA2.12.1. And the question is this BA4 and 5 going to take over that? Now, these are all in the Omicron family. And so we'll see what happens, but these cases are doubling at a very quick rate.
Wow. And for our last big COVID headline and our last story for today, actually is, quote, we're playing with fire. The US COVID cases may be 30 times higher than reported. What can you tell us about what these numbers actually should be, Dr. Murphy?
Well, it's, I had said, I mean, off the cuff, not any model that I'm working with or anybody I know, that, maybe the cases are 10 times higher because of all these home tests. What this group has done is that they've included the modeling for the people getting home tests, so they're not counted, all right? But it turns out there's a lot more asymptomatic infection than we had really thought. When you start doing the serologic studies, you find out that a lot of people are, they're not even getting tested and they have COVID. So you put those two groups plus the people who are diagnosed by PCR and reported, and it may be 30 times higher. I don't know if that's right or not, but if it is, you're going to see that peak drop off pretty soon because everybody's already infected.
Wow, that's incredibly scary. Well, Dr. Murphy, that is actually all for today. We're going to skip our questions and we'll come back to more questions next Tuesday. Thanks for tuning in, everybody.
All righty. See you next week. Have a great weekend.